Welcome to Enlighten Radio. My name is John Case, and the program you're about to listen to was recorded on May 27th, Plague Year number 1, here at the enlightenradio.org studios in Bolivar, West Virginia. Actually, we call it the Red Caboose Studio. Today's program welcomes Patsy Noland, County Commissioner for Jefferson County, West Virginia, and a discussion with our gang of the End of the Road crew. Here would be Larry Bish, James Boyd, Mike Diesel, Cuccarini, and John Case. I hope I mentioned Larry Bish. I guess I did. And so Patsy is going to talk to us about the challenges of COVID in our county. Constrictions that Zoom, but I think we're actually all rolling. Okay. Yes, Mike, please introduce us, okay?
Good morning, ladies and gentlemen. Good morning, Mr. and Mrs. America and all the ships at sea, and welcome to Enlighten Radio's The End of the Road broadcast, brought to you by your original dusty-footed philosopher, Mr. John Case, and his sidekick and very wise elderly statesman, dusty-footed philosopher himself, Mr. Lawrence Bish, and I'm the big mouth announcer guy, Mike. And our wonderful guest this morning is Patsy Noland.
Good morning, everyone.
You would have thought that Mike was kind of introducing a wrestling contest there, but
wasn't
yeah.
that? The wrestling's like really, really much louder. The wrestling's more like, all right, ladies and gentlemen, welcome. It's more.
That's it.
Yeah, deeper.
Got that down pat.
Yeah.
Anyway, well, welcome to the Larry. We have how you doing this morning, buddy?
Okay, thanks.
Okay.
Went and did a pickup at Walmart yesterday, so we're all set.
I did a short, somewhat fictionalized biography of you a couple of minutes ago while we were waiting for you to come on.
You did.
So, yeah. Oh, really?
Yeah.
Yeah.
Mostly true. Okay.
Hey, John, can you give me about? I'll be back in about 3 minutes.
Okay. Good enough. All right.
We can warm up the coffee.
We can get started here. I'm so happy that Commissioner Patsy Noland has joined us this morning. She's I don't know, how long have you been on the commission now?
This is my 12th year.
So you have seniority,
I have seniority, not that accounts for anything.
I know it's not exactly a union shop. I understand.
No, that's right.
But anyway, I'm so glad you joined us, and I've followed you a little bit, on Facebook and the media, but I've been waiting to and I've listened to some of our state representatives and state senator talk about the situation from their perspectives as legislative representatives, but on a day-to-day basis, and certainly with respect to the finances of the public sector, it's really the county that has the sort of boots on the ground job in this whole thing, and has to sort of we have been assigned to do A, B, C. Let's see if we have A and B in the house.
That's right.
Anyway, so I'd like to hear your views and your reactions. You've been going through this now for a couple of months in your capacity as county commissioner, and I know you guys are under a lot of different pressures and challenges, and I don't want to guess at them. Why don't you just help us out and tell us how you see things from your standpoint?
Well, it certainly has been a difficult time that none of us could ever have envisioned we would be dealing with in this day and age. But it's been a real challenge. You want to be able to serve the people. You want to be able to keep the doors open, administer to their needs, and to be able to be sure that they can conduct the business that they need to conduct at the county level. And I think we've done a really good job. We've done the best we can do. And I think we've considered everything that we've had to consider, but most important is the health of our employees and the health of our citizens. We've been following the governor's guidelines as best we can. We've adopted policies and procedures within the county. The courthouse has been open to a point, but if you have to go, everything can be pretty much done online. However, there are some things, papers have to be signed and things like that. So if you had to conduct some kind of business in the county, you could always call, and the county commission would answer the phone and they would direct you to the person that they would need to talk to facilitate whatever business they have at the courthouse. So the Planning Commission, so as of yesterday, we've reopened the building on a limited basis. Appointments still need to be made. We're asking everyone to be able to please be considerate of the distancing, social distancing. We're asking everyone to wear masks, and especially the employees. And if they can't, then please keep your distance. This thing is serious. We've seen too many people infected, too many people have lost their lives to it. And it doesn't necessarily just impact older people. You know, we've seen younger people pass away as well as a result of COVID-19. We don't want that to happen on our watch. So the county, I think, has done a good job of trying to do the best we can, yet still continue to do what we need to do to serve the public with the needs that the services we provide. The county clerk's office is still, because today is the beginning of early voting, and so the county clerk's office is going to be limited to certain things that are necessary. You have to call. If you need something other than early vote, you can call, make an appointment, and go in. I think there were close to 5,000 mailed ballots that went out of there. It took every single one of her deputies the time to do that. And now they're getting all those back. They have to, and now they're conducting early voting. So their desks are piled full of paperwork from the election. And so they are doing their best to be able to both operate the election and to continue providing the services that are essential to for whatever citizen might need to be done.
Do they need more help? I mean, to be able to do that? I mean, the staffing for before COVID was maybe one thing, and now is that
well, I
can
think
they do the job? Really? And that's
well, they have some great ballot commissioners, and they have some, their employees have focused all of their time and attention on doing rather than doing the all of the other jobs that they did. They've had to prioritize. So they have been able to, it's been very stressful, but they've been able to make do with the amount with the number of employees that they have. And they have ballot commissioners and that can step in and help too. And the ballot commissioners actually meet the public and conduct the early voting. But there's still a lot that goes on behind the scenes with elections. And so they deserve tremendous gratitude for being able
essential workers.
Oh my goodness, absolutely essential workers. And you know, everything is, because everything is under a time, excuse me. Everyone and everything, it seems like, in the courthouse are under time frames. You know, there are so many days, for example, in the circuit clerk office, in the planning commission office, and Office of Planning and Zoning, they are all under time frames to get things done. So they've done it, and they just deserve a tremendous shout out for being able to do what they've done in the midst of all of this and stay healthy. You know, we're also, as people come into the courthouse, they may have their temperature taken, and we ask them the questions: how are you feeling? Have you been sick? The routine questions that go along with the COVID symptoms. And if they, if any of the employees have those symptoms, we would ask them to go home, and if possible, to work from home. A lot of people have been working remotely, and they've been very effective in being able to do their jobs there. They just haven't been able to see the public, but they've been getting their work done even from home. So it's been a challenge, but we've worked through it, and I'm really, really, really pleased with how things have turned out. Of course, you always have people who are going to be upset and angry that we're taking this so seriously, but you have to do what you think is right, and that's what we've done. And
I know
the governor's guidelines.
I know our panelists here. I'll call them panelists for a moment. I have questions, but the first one I wanted to not let you get past with the biggest expense in the county is education, and I know the Board of Education is primarily responsible for that, but nonetheless, you're going to get to the fall, and the question of can you reopen the schools is going to be a practical, regardless of what someone's advice might be, politically or otherwise, okay? There's the actual act of actually doing it and attempting to do it safely. How do you have any, I know nobody has a crystal ball, I understand, but been thinking about that one? Problem?
Actually, I have. Of course, the school board has their work cut out for them. I'm not sure what the answer is to that solution. I've heard a couple of different things. I've heard that they're gonna that those who are enjoying being educated remotely through Zoom or whatever other media is available, they may still be able to continue to do that to cut down on the number of people that are actually in the building. So I think that's something that's a very difficult, and this is almost the 1st of June. It's going to be a difficult thing to have to overcome, and I'm not sure how the Board of Education is going to do it, but
Right.
Certainly whatever they decide, I know that they'll take the best interest of the kids at heart and do what they think is right.
I know I talked to a teacher, longtime teacher, who's a member of the Labor Council the other day, and she was saying that the concern that she had with they were working very hard on using the remote equipment, but a number of the kids are having to interact with the Google Classroom platform through their phone. Just their phone. They don't have a Chromebook or something like that,
Right.
And so there's going to be that population. Obviously the interface is going to be very difficult to use as your phone. To accomplish.
Can I pop in? By the way,
Yeah.
you guys have all disappeared from my screen. I have Zoom.
Oh,
Really, I see you fine.
I see you.
I can't see any of you. Maybe I'll rejoin. And
if you want
is that
to,
right?
yeah,
Okay.
we'll try to rejoin and yeah, sure.
Okay.
Okay.
Let's see here.
Well, not seeing me is probably a good thing, Larry.
I see you.
Well, you're sure you're through that existential camera that you have there.
All right.
It's not exactly like being spied upon, but I have a master's degree in distance education that I earned 10 years ago.
Wow.
Where did you get that degree?
Where? UMUC.
You got okay. Yeah.
I got it online.
Gotcha. Okay.
But it wasn't the University of Phoenix. It was but an aspect of that, I think, needs to be understood. One thing that I know and I learned in that graduate program is that it's sui generis online education. It's not just put your lecture online, or even anything like it. It's totally different learning environment in many, many ways, not just physical presence. And it's an adult model of education, and I'm seeing it just slapped on everywhere. And it's not going to be effectual because not everybody has learning styles conducive to using online education. And so it changes the way you could you know, every class has people that learn more easily this way, that way, and there's somebody going to be somebody
Right.
not.
It would do the classroom dynamic, right?
It changes it entirely. So the kids that are really, really smart but don't have these skills, it's real writing intensive, you know.
Yeah, and I agree. I think I've taken some online classes, and I find that I would much rather be in the classroom. And not only that, but there are so many areas of the county that don't have internet service.
And there's that, yeah.
So I think that, you know, everyone's not on the same level playing field to begin with. And so I think that that's something that needs to be considered. And I know that the school board is considering that. That would have to be a priority for them. You know, it's unfortunate, but our internet capability, I wish were better. And we're working on that actually at the commission level. But hopefully we'll be able to accomplish something, you know, soon. We have a consultant that's looking at the different areas that are unserved and underserved. And hopefully at some point in time, we'll be able to remedy that situation.
Maybe there will be some program to provide tutors to children that have problems with it. And maybe someone who visits a house even, you know, because really that is a major aspect of online learning. First of all, it's an adult learning.
It is. That's that kind of attention you're demanding visually, and you know,
and you're self-motivated and all of that.
Right. I would guess too, Larry and John and Patsy, the one thing you'd have to keep in mind is if you're going to have a tutor come over, social distance.
Yeah, right.
You know.
Yeah, there's that.
Are you going to have the tutor like maybe outside the garage? You know, with the garage door up, and you sitting at a desk, and
yeah.
You know, the tutor like, okay, here's my lesson for today. I don't know, but I do think.
Okay, my tutor's dumb idea. Okay, all right.
Yeah, there's a loss of. I think there's a loss of interconnection learning when you're together in a classroom. I think that's a real energy that that's just not there. It's just not there.
Yeah, I agree. I think, and you know, young people especially, you know, some of them are at very vulnerable ages. They need that social contact. They need to be with their friends. I mean, they do enough online. They do enough of the thumbs on the phone screen that takes really them away from being able to interact with their friends.
Pokemon was right. I'll click away, you know.
Yeah. So yeah.
Well, I think
so
I think any parent, okay, who's you know, raised children, you know, you have that kind of intuitive, if not instinctual, sense about, okay, who are their friends? Right? I mean, because you already know, right, that, you know, depending on who their friendships are, one group of friends might be interested in studying in school, and the other might not be at all.
Yeah.
Okay.
Right.
And so you got, depending on the kind of, you know, and everybody knows how groups bond, okay, and what's considered cool and not cool, and all these things that are part of growing up, right?
Remember the mods and the rockers?
Yeah.
Is that what it was?
Mods and rockers.
I tell people all the time.
I unfortunately was a rocker.
I was very interested. I was very interested in studying in school. It's just all the voices in my head said no.
That's right. The other guys you were talking to on your head, right? Okay. Well, now just another sort of particular question here. Suppose, you know, you did not respond in timely in the mail to the assessor's, you know, form there, and you now can't get your car re-registered unless you go to the assessor's office here in Charlestown. But they're not likely to be open for that kind of business. So what happens to services like that, right? Does that one of those signatures required, or a payment has to be made right there, right?
Well, we
Yeah.
can do a lot of that online. For example, the tax office, if you need to pay your taxes, that can be done online, and then you can print off your receipt for those of us that have that capability at home, but a lot of people don't. And in that, under those circumstances, I believe that they were able to contact the department head and make arrangements to have whatever they needed to make that contact. So I don't think anybody was left without being able to do what they need to do or have what they need to have to be able to exist. And I also understand that there is I just read this morning, that there is a 90-day extension for people whose inspections were due, car inspections were due, and that kind of thing. But I don't know a lot about that. I just happened to read that this morning.
Oh, okay, right. I think there was because the state office DMV was closed for a while. I'm not sure. Is it open again? I think it is.
I think it did open
yesterday.
Yeah,
Yeah.
I think everybody pretty much opened yesterday, even to limited capacity. If you can do it online, if you can accomplish what you need to do online, then recommending that. But you may have to wait a little bit longer if you're going to the DMV.
Okay, let me ask you one other question about our public health infrastructure. I noticed the terrible thing that happened in New York was for whatever reasons, right? I mean, it's a much more dense, population, and there's all kinds of factors I understand going on, but still, there was that point at which the public officials realized that the epidemic was overwhelming their health infrastructure, and personnel and actual facilities, right? And and as a consequence, their count even of those that were sick and passed away had to be later almost doubled because of the number of people that fell ill and actually perished in their homes. Okay.
Right.
So, I mean, what feeling do you have about our health infrastructure in the county? I know a lot of it's state run at the West Virginia University stuff, but nonetheless, if people can't get into the hospitals or the medical facilities, it will end up being the county's business of finding them in desperate circumstances. So, how do you have any sense of where we're at on that, and are we?
Well, I think that we're all under the state guidelines, and everyone is trying to follow as best we can the state guidelines that were put in place. I think that the health department has done, I think this trace testing, I think, is important. And I think that we probably could have had more testing. Had we had more testing, the numbers certainly, they would have increased because there wasn't much testing, originally. But I think department has done the best they can do. I think they've done a superb job of following the state guidelines, the DHHR guidelines, and then the county has also followed those guidelines. Could we do better? I don't care what you do. I'm sure we can always do better, but I think with what we had to work with and what we knew at the time, I think the health department has done a great job. I know I heard from some businesses that were just livid that they couldn't be open, and it's a big economic issue, because when you can't open, I feel so badly for especially small businesses that depend on that daily revenue that they have or didn't have coming in. But I think what happened was that our local people, our local citizens, did as much as they could do by, for example, the restaurants. the pickup services, buying cards, gift cards, and things like that. That probably helped keep a lot of their doors open. And I know I stood in a couple of those lines, and it's a slow process, but to me, it's worth it. But I think the health department overall has done a good job, and I don't know what else they could have done differently to have made it better.
You guys got any questions?
I always think about my sister-in-law Meredith and her partner Debbie, and
Yeah.
downtown, and you
Right.
know how difficult that is because it's a retail thing, and it's such a specialty shop, and it's just so beautiful, and they have so many loyal
It
customers
is.
from all over the place that can't come now. So I mean that are compromised. And also too, selfishly, I went through an experience, or I'm going through an experience right now. I have mild COPD, so I can't really go out and about or do anything unless I have a mask on, or unless my wife says it's okay. So
And you always listen to your wife.
Roles change.
Yeah, but-
See how
but-
roles
but-
change through life,
what I'm going through right now is I use a nebulizer for
Yeah.
steroids to get into my lungs to help, and I was unable to use it all day yesterday because the motor burned up.
Oh,
So now
wow.
it's supposed to be a 5-year warranty on the thing. I got to call into Harper's Ferry. I almost called John and said, John, you're right there. Go over to Harper's Ferry and yell at these people for me so they can call in the prescription.
They only come. You have to yell at them when they come out to your car. You can't go.
Right. I was well, yell at them from the car, John. Bring like a bullhorn or something. And I was come to find out that my pharmacy, Jefferson Pharmacy, is the actual supplier of the nebulizer, which is good, but all they need is the callback fax thing from the doctor. And I called over there, and let me tell you, they're busy because
Oh, yeah.
2.5 hours on hold.
Wow.
And still it came back. It kept telling me where I was. It says you are now number 3 in line. You are now. I got to number 2. And you know how your hopes start to go up a little bit?
Yeah.
Well, that's
Then they come back
Not
and
much
go,
longer.
then they come back and go, we can't accept your call. Please leave a message.
there you have it. There you have
That's
it.
the worst.
Oh my God. So
But
I
what
just
about the
I left the
people that spent
messages.
300
I think my wife
calls
was
to
so
unemployment?
mad. My wife was so mad. I think she was ready to drive over there yesterday. She may, in fact, drive over there this morning and just say, "Hey, look, guys, and bring the nebulizer that's broken and say, here, look, see, we're not lying. It's broken."
Wow.
I'm sure they're overwhelmed.
Yeah, and I know, I'm sure they are
Oh
overwhelmed.
yeah, that's what we're thinking.
And in this day, right now, I don't know what they're doing within their offices. I know my husband had open heart surgery back in March. So we were, and that was during a time I was able to take him into the hospital, get him ready on March 23rd, getting ready for his surgery that day. And they let me spend 30 minutes before, and they were supposed to let me spend 30 minutes after the surgery. But the nurse said, that could change between now and the time his surgery is over, and it did. And I was not able to see him for 8 days for his surgery. The best we could do was FaceTime. Thanks to the wonderful nurses he had, they set him up on FaceTime because he doesn't do that kind of stuff. He doesn't do any of this. So it's been very stressful at both ends. And I know, even today, that his office visits, he had follow-up. Of course, they wanted to see him, and so he had a couple of those, but everything else has been either Zoom or a different kind of visual
telemedicine.
Telemedicine, right? Yes.
No.
Real quick.
Go ahead, Larry.
But John, I just want to let you know, Dan is on his way to the Cancer Treatment Centers of America in Chicago.
Oh, so he's not.
Yeah, my brother's not gonna. I don't think he's gonna. I think his plane has just landed. I think out there just for a follow-up checkup.
Oh, he
had stage 4. He was diagnosed with stage 4 colon and liver like 6.5, 7 years ago, And he fought it and fought it and fought it. 3 surgeries later, 37 chemo treatments. One of or 2 of which he coded on the table. He's I told him, he's like,
he was going to call in today.
I said, you have a lot in common with cockroaches.
He's a woman.
Excuse me. Let's let Larry. Larry had
Go ahead, Larry.
Well, one thing about you said about Candace deciding whether or not you leave. This one thing. This is really taught us all is who makes the final decision. Because I thought I did, but I was totally wrong. Anyway, yeah, I was living in a fantasy world. But I had throat cancer last year, and chemo and radiation. I think I had 37 treatments. And the last was last March. So I'm still in follow-up, like you said, Mike.
Yep.
But that's all changed. Now I use VA exclusively, and I will argue with you all you want about socialized medicine and whether I have better treatment than you, because I know I do.
You're VA. Okay.
Yeah.
I want to get back to
I just wanted to finish the tele.
Oh, go ahead. Okay, I'm sorry.
Yeah. So my follow-up dropped away, and they call me Tuesday at 1. A nurse calls and interviews me, and that's all. But if I swallow it, it doesn't feel right. There's a feeling of no, because it come back. That's why it's
sure. That's right. Yeah.
And then when you're discussing or thinking about, okay, what's the real tally of fatalities? I don't think we have that at all. I don't think we're going to, because people die from lack of care, not related to COVID.
Right.
It's related, but
yeah.
Certain
I think he's right. I think some of the folks just rather stay home and not be, can't be, or don't have the money or the will.
Yeah.
Right.
I saw 30,000 as a figure of that population.
Nationally, you mean?
Yeah.
Okay.
Wow.
Patsy, but this a critical question. I've been reading all these. My wife's an economist, okay, for the National Science Foundation. But
unlike John, who plays one on,
I play one. I read all the books she gives me, and I try to read all these guys, and I've got over the years I've gotten so I understand them better than I used to. But a bunch of them, Nobel Prize winners included, now are saying that the recovery from this situation is not likely to be quick. So you're talking about a 10, 15, 20, depends on who you talk to, percent smaller national economy coming out of it than you had going in. And I think we all know the dangers of what happens. You can end up in a scramble for crumbs that ends up being just ugly all the way around, right? And or you can do a Roosevelt kind of thing, and but that, of course, it doesn't even happen by design. History just sort of says, okay, it's time, and maybe it happens, right?
I guess. Who knows?
Nonetheless, I know you just from hearing how you were talking to small businesses in the county, and also the people that I know personally I've been talking to. The tax revenues for the county are going to fall in some proportion to this probably very difficult economic recovery. Okay. And what's the impact of that on, well, I'm sure you can't say in detail, but that's going to have a big impact on your budget, right? And on a lot of parameters. Can you speak to that?
It will have an impact. We were surprised actually Thursday at our county commission meeting. We were surprised that we were expecting, a big impact and because of the video lottery, table games, the gaming revenue, because that all stopped. So we were expecting a big cut for the remainder of this fiscal year as a result of that. But at Thursday's meeting, we were surprised to find out that the alcohol tax I guess last year, and I kind of lost this. I didn't realize it was happening, but we got almost $300,000 from the alcohol tax in the mail. You know, we get that from time to time, but this one was a surprise. So it helped us out of what the financial impact would have been for this year to the county. And
Oh, that's
so
good.
next year,
Wait, but you're not saying this is because of increased alcohol consumption here in the county during the.
that may have something to do with it, but
How dare you,
for me
sir?
I do my part, and I'll gladly
Well,
go out and replenish my Johnny Walker Black. Just
thank you. We appreciate that.
Chicken, wild turkey.
But you think it's something
Here.
asynchronous, or was it just an accident, or like?
Well, we didn't realize that. We kind of heard about, and we're pretty good at following all of the legislation that comes out of Charleston. We just didn't see this one coming, and we knew that there was a tax that had been. There was legislation, but I guess we just kind of forgot about it. And then we get this check in the mail, and it's like, wow, it's almost like, I don't want to say divine intervention, but it really helped us out.
From an unlikely source.
Hey,
exactly.
Anytime you get in like found money, that's like, wow, we weren't planning on this, but we'll definitely use it. Yeah,
we'll take it. That's right. Well, but next year could be a different problem. I mean, we are looking, it depends on whether or not there's a round 2 and how we're impacted by that. But our financial director told us on Thursday that we could be looking at over $800,000 deficit next year, which is going to require a lot of looking at priorities. What are the priorities? And the number one priority for the county commission and our budget is that we first have to operate our county offices, and they have to take priority over everything. People don't understand that, but that's the law. So, and then you have to look at emergency services. How are they impacted? They're impacted all the time because of the we're a tourist destination here, which is why maybe that's why our numbers are higher. My husband and I took a ride yesterday afternoon. It was such a beautiful afternoon. We rode down by the Bloomery and through Millville along the river. It was absolutely packed. I don't think you could have squeezed another car anywhere along that river. There were people just all over the place, and that's good for tourism, but not so good for COVID. So,
well, you keep people cooped up for a couple of months, and
you're right. You see that, Patsy and John. You see that, and Larry. You see that, but then you look and you get the interviews from doctors in Montgomery, Alabama, who's the head of the ICU. Say, look, I don't have any beds left. I don't have any beds left.
Exactly.
And then sister hospital, he doesn't have any beds left either.
Yeah, and that's the problem.
The numbers have exploded in Alabama.
Yeah, and I hope they don't hear. We're all ready for it. We'll do the best we can.
Yep.
Well, sometimes people have to learn by experience. Yeah,
you do.
We went for a drive yesterday as well, and we go. So one of the things I'm always looking for is how many people, what percentage are wearing masks, and it's getting better. It seems to be. You can't just look and see, but it seems to be getting better. And the people not wearing masks all have that kind of aura about them. It's my freedom. You got that mask on.
Come on,
what do you do with that? You know what I mean?
I'll sock you in the face, COVID.
You're gonna say, hey, this mask is for you, buddy. You know what I mean?
Exactly. We wear them whenever we.
This is something I'm doing for you, and you're not doing for me.
That's right. Exactly. Right. Just have a little consideration for the rest of us.
My wife tracks all of her out whenever she goes out. She always does tracing. She says exactly. She has a chart where
your wife is a trip, man. I can't.
She just does it. She types it in and says, "Okay, I went to this, and this," and You know, here's my, you know, and she even said, Larry, she's with you. She said that she has been seeing a lot more masks.
Hmm.
That made her feel really good. So,
Yeah.
you know,
Well, we drove up to a Mennonite farm over the weekend and got a new puppy. And
Oh,
right,
Oh,
it's very, it's just, it's like having a new baby.
yeah, they
where's
are.
Lizzie? Where's Lizzie?
Uh,
yeah, it is. It's
but
exactly
but
like that. Yeah.
but in Pennsylvania and in Maryland, going into the stores, you had to have it. They required a mask to come in the store.
Mhm.
And you know, and if you gruffled about it, I mean, they had one there to sell you.
Hmm.
Okay.
There you go.
Well,
Okay.
that's
I
what, you
mean,
know, John. That's what we were talking about. I was talking about with you that Fran, myself, and Patience did. We made like I think 350 masks. Mostly Fran did most of the work. We cut the material
Good for
for
you.
her, and then she just gave them to like put them in a box right outside a Food Line.
Yeah.
And people could
That's
come in and just
okay.
grab a mask, and if they forgot, because
Yeah.
one gentleman walked in and he was like,
well,
"Oh, I forgot, I don't have a mask." And honestly, he did. He was in a hurry. He had, you know, a young father, had kids with him. He was like, you know, the kids are like got their cool looking
sure.
masks on that they painted pictures on and stuff. And here's Dad just kind of, "Oh, I forgot." And he grabbed one right out of the box, you know. So Fran she saw that and she was really happy. She was really happy.
Yeah,
Yeah.
our daughter and I have been making some masks too, and she's probably made 200 of them, and
Cool.
yeah,
Sounds
so
like a project all the churches could do.
yeah,
We'd
And they
like to
are though,
see.
John. They are.
We'd like to see the public servants have them. Like if the police are going to stop you and say, "Where's your mask?" They should provide you with one. We should
Mhm.
have that. We're the richest country in the world. What in the world is going
Yeah.
on here?
Well,
Little
I don't
paper
think it.
masks. You got to be kidding me. I
No,
mean,
we'll
that's
send them.
just
Maybe
so
send them through the.
outrageous.
You're going to send them through the prison system instead. So,
Oh yeah,
no,
it is.
no, no, no,
Yeah,
no.
that's another problem.
Sure
Yeah.
is. Sure is.
Yeah,
Well,
that's what isn't that what happened in Nebraska? No, it was Ohio. Ohio was like, okay, that's it. We're gonna test everyone in every prison.
mm,
They started testing and they got to like the third prison. They were like, okay, that's enough. This because there's like 90% have COVID
Yeah.
in every
Right.
prison. And they were like, these numbers are too bad. Stop it. Stop it. Stop it right now.
Yeah,
and what Patsy was saying about
politics is weird.
the courts, they're having to redo how they do hearings,
Hmm.
and that sets it way back. And I know that can be set back for a year. You can sit in jail waiting to go to court if you don't have any money. You know, now what? My goodness, it's got to be terrible. I mean, I haven't seen it. I called in a couple times, but
Hmm.
I don't know what they're going through that way. Not much movement, though, I'll bet you. And so these guys sit in a place that's a petri dish for what everybody's trying to avoid. It's just not a good thing.
No, that's right. I know the judges have scheduled their hearings in such a way that they're keeping people away from each other as much as they possibly can, and requiring masks, which
Hmm.
is just have to
Hmm.
do it.
Yeah.
Sometimes
Those officers
inconvenient,
have
but
to load a bus up and take them to court.
right.
Well, I mean, other countries have shown that that the social distancing and masking does flatten the curve if you really are,
Mhm.
especially if you're aggressive about it. Okay.
Right.
And I mean, and you can't. I mean, I heard the argument for a while. Well, it's just because the big cities and the density. But I mean, the one thing you can say about China is that they got more people than anybody, and
Right.
denser cities. But nonetheless, I mean, it might have been draconian, but they did curtail it. Okay, so and where it erupted,
Mhm.
and other countries I think got in front of it better, actually.
South Korea.
South Korea, some other
Mhm.
places. But,
I mean, they
again,
even had a bounce back.
those are smaller countries, and a country of 300 million, not quite the same, and 50 different states,
Yep,
not
different
quite the
animals.
same as.
Yeah,
But
and
still,
I recall seeing videos or pictures of people in other countries wearing masks. And I always thought, wow, they must be sick, or maybe they're afraid of getting sick. I didn't pay too much attention to it, other than the fact that I just thought it was odd because they all had masks on. And now I get it. And I think it's unfortunately taken something like this for us to realize just what a difference a mask can make in spreading
transmission. Yeah, sure.
Absolutely.
Absolutely. Well, okay. So what's the summer is here. It's supposed to be our busy time for tourism, and I did see Harper's Ferry pretty jammed up here on the weekend. Okay.
It was.
It was.
Yes, it was. I rode down yesterday to our visitor center, Jefferson County's new visitor center. That's not open yet, by the way, but I was able to take a look inside. And while I was standing outside talking to Annette Bates, a guy pulled up on a motorcycle and said, "Can you show me how to get to the river, or tell me how to get to the river?" So of course we did. And the town was packed over the weekend. It was just shoulder to shoulder people.
Right.
You know, and that's normal for Jefferson County. That's what we see this time of year.
Right.
So, and I saw the tube companies, the river tube companies had people in their buses down at the river yesterday. So, you know, tourists, people can't wait to get out. They can't wait to get out of the house. They can't wait to get some fresh air. They can't wait to have some fun. And, you know, I just hope that we are able to withstand
a second wave,
and not have to interfere in their fun again. But I'm very optimistic about that.
I had a party yesterday at my neighbor's house. It was me, the weed eater, and all of her tall, overgrown weeds underneath her solar panels. I was dancing with the weeds. We were.
That's what it amounts to, isn't it?
For about 3 hours.
Our granddaughters come visit us. They sit out on the patio, and we sit inside in the family room with a screen in between us. And that's just about as close as we've been able to get to them. And I just can't wait. For me, I can't wait.
Yeah, that's my mom's said. Yeah,
my kids. Yeah.
My mom went down on Mother's Day she lives not too far from my younger brother and his kids. And she, two boys who are rambunctious teenagers. She walked down the street, sat in the driveway, and the boys were in the garage.
See, isn't that awesome? I mean, that's just, I think it's a new way of life. I'm not so sure I'm crazy about it because I'm a hugger. I love to hug my family.
Our whole family
friends.
is.
Yeah. So it's
Italian in us. We're very Italian.
Sure. Yeah.
Is that what it is? Okay.
Is that what it is? Okay.
Spread around, you know. But
Italian and Greek.
My grandson yesterday was really you know, my wife was showing him the new puppy. Okay, he's like what, 6 right now.
Oh.
And so immediately he starts talking to his mother about wanting a puppy. Now they have an elderly dog. Okay, that's, you know, a little infirm. And so this negotiation goes on, you know, right on Zoom, basically, okay, about how can he convince his mother to get a puppy, like is on the screen right there. And so it turned out that they did negotiate a contract where if he picks up the poops of the existing dog for every day for 6 months, he can get a puppy.
Wow.
Wonder how that's going to go.
That was a sales job on the part of my new puppy, I think.
I know your grandson, and he's very smart.
So it went around the circuit of grandchildren, and so my granddaughter in California, she got on the Zoom phone with me and played me a song that she had learned. I think it was a Led Zeppelin song, actually.
Hey, look who's coming on here.
And it's James. James Boyd.
Right.
Yeah.
Hi, James.
Hey, James. We got Patsy Noland here on for another few minutes here. How you doing?
He has like a disco star behind him.
No,
he's in outer space.
Out. Yeah. Well, I'm in San Francisco, right by.
I see you are. Yeah.
There. These Zoom gives
Oh,
you
look.
choice of backgrounds. You get a virtual background.
Hey, look who's
Okay.
coming on here.
Yeah, I'm on the move.
Wow.
Oh, it's James.
Oh,
Listen,
you're listening. You got to turn off the tape there on YouTube there, James. Otherwise, you're going to get a.
James, you don't have a head, James.
Well, that's because he's got
Yeah,
a
his head
star.
just
He's got a nebula in back of him there. Of
I
I
some
see
sort
his
of
eyes.
background.
Yeah.
Anyway, we'll wait until he gets connected.
I feel like going when I see James now in that picture. I feel like going ooh, like the Star Trek. Oh.
Right. Okay. By the way, James is very active in the. Although he's relocated to New Jersey, but he was very active with Senator Unger in the coaches program of addiction recovery, especially in Martinsburg, where there was a serious. Well, not just in Martinsburg. So he had a lot of experience there, basically in the emergency rooms and hospitals with folks, in the opioid crisis. And I kept talking to him. I kept thinking about, and I was talking to Senator Unger about this too, is that, if this unemployment persists at a high level, or this lack of we're not able to use our human resources at a certain level, I mean, I think it would be important for there to be, at least programs of community service that we could try to recruit people into to help each other in cases where maybe the public services for budget or other reasons is just not, able to do everything. Okay. There ought to be maybe some models, or maybe through the churches. I'm not sure, but it ought to be a way to fight the battle for crumbs syndrome that can, easily infect everything. And so I'm wondering if we find ways to stimulate public service. Maybe it'll just happen spontaneously. I mean, some of it is. I talked to the people from the Shepherdstown Shares the other day. That I think is sort of a continuation of what they used to do with the caring cupboard out of the Lutheran Church, which was, during the last recession in 2008 and 9, where they were delivering 150 baskets of food a week.
Wow.
There's a big food bank in Charlestown. Right?
So these kind of things. We're going to need
Yeah.
these kind of things. I mean, rather than having people say, I got no other choice, I'm going to go out and rob the convenience store.
Well, I helped. I remember helping some of the drivers. I remember like grabbing like stuff that was overloaded from them and for the church and stuff, and just through friends, not through the church, because I'm not really affiliated with any particular church because they won't have me. So
oh, come on. That collection plate is I'm sorry, is usually agnostic. Okay.
But yeah, I just some of the great work that's been done, but it's really, John, like you said, it's that's going to be something to behold. We have to be very careful going into a situation where you're really in unfortunate circumstances forcing people's hands.
Yeah, absolutely. So, I don't know, Pastor, you got any thoughts on? Well, probably prayer. I guess what I was uttering more of like a prayer than a thought. Okay, but you have any thoughts along those lines?
Absolutely. I think this COVID crisis is not going to help the work that we're trying to do with the epidemic, the opioid epidemic. I think. With so many places closed down, that the treatment centers and the clinics and all those places, I don't know how they've been able to handle all that they've been able to do. It's going to take a lot more. We need more resources to be able to handle those things, and we have some great programs in place. But for those who aren't able or don't have the means or resources to be able to take advantage of those resources, it's a tough. It is going to take. It's going to take a lot of us to be able to contribute something to help this situation. And
I'd like to weigh in on it, if I may.
Go ahead, please, James. Welcome, by the way, James Boyd, host of our
James,
recovery show.
welcome, James.
Hi,
How you
James.
doing, everybody? Yeah, from Belleville, New Jersey, I'm coming in. But yeah, I'd like to weigh in on the progress that's being made, how the providers for MAT and the rehab centers, and they're able to make that shift into creating, healthcare virtually, and it's kind of like baby steps. So I'm just grateful to be on the ground floor of that shift and how they're doing, how they're faring. I'm able to provide some input, and most importantly, I'm able to learn, because this is a learning curve for everybody who is a provider, for everybody who is in recovery, or for everybody who needs to be in recovery, for the families who are seeking recovery for their loved ones. There's an opportunity for us to be able to shift in a way that is not as painful as one might think it would be. The struggle with the Eastern Panhandle and all of that is the internet service, I'm finding, because the
Exactly.
population that I deal with, they don't have that access, like the young lady was saying a minute ago, to be able to point them in the direction, and to be able to to sift out the things that shouldn't be in place for this new shift of behavior, and to apply the things that should be in place. And if we don't have the things that we need to provide optimum service, then we're able to identify that and get the things that we need, or have and fortunately we have some policymakers who are on board with with the kind of care that we call compassionate care, restorative justice, and so this is proof positive that it takes a whole village, and I really appreciate all the work that is being done in West Virginia, particularly the Eastern Panhandle. All the work that's being done, and it seems that everybody is on board with learning a new kind of behavior, a new kind of approach for the people who are sleeping in the woods. People are still sleeping on park benches.
And I agree with you, James. I think the attitude overall has changed. There was a time that was just not acceptable, but I think attitudes have changed toward that, and so I think that's really a good thing. I wish there were more resources to be able to accommodate all of those people that are sleeping in the woods, sleeping in tents. But maybe someday, we can always hope. But I do believe the attitude toward them overall has changed. And I'm glad to see that.
Speaking of so recovery, we got about what do we got here? Oh, we got about 7 minutes here. Maybe a time for some closing remarks, if and then maybe Mike, you can at the end you can take us out in some
Razzle dazzle.
typically extravagant way.
How dare you?
Okay. Yeah, but yeah, I just think that moving along these lines in community organizations, finding ways to serve is going to be so important, and maybe the only things that you can't always, regardless of how national or statewide or worldwide developments in this whole thing occur, many of which will be out of our control locally. I mean, I know we all have opinions and everything on that, but nonetheless, we're going to be faced here with relying upon each other in important ways that maybe we weren't before, and I think finding those ways through all the different community organizations, faith communities, et cetera, everybody, and political associations, whatever, that are going on, employees, labor organizations. You got to find a way to, to put your foot into the circle. And I think if we do that, then we'll come out the other side somehow. But everybody knows how bad this kind of thing can get. Okay. I mean, we've all had history courses. Everybody knows that, should know that you're running a pretty dangerous bridge here on a lot of different questions. And the pandemic has made them unavoidable in so many ways. Anyway, that's my thought on it. Anybody else have a closing thought on this? Want to weigh in?
I think,
Go ahead.
Okay, here's summer. After a winter, everybody, in normal circumstances, everybody wants to get outside. And so now that we've been forcefully, confined, that's really going to be a hard thing to constrain. The other thing is an awareness, like John, you talk about the economy, an awareness of what it is to be a small business person. Sure, we know, okay, they have employees, but I was a musician my entire life. I have worked for gig work for small business, bars and restaurants. And I can tell you that the owners work way harder than their employees, I mean. And they're absolutely committed to their business. And if that's gone, I mean, I know just not going to work for my profession, it tears a hole out of you. And I think there's going to be a lot more angst down the road. I think we're going to see a surge. I don't see how it's avoidable. I think when you look at Bangladesh, India, what's going on over there, this thing ain't going away. They have no way to control this virus. They're going to be dying in droves until we find the vaccine. And as long as it's there, it's here. Good is here. And that's what we better get through our heads. We're not going to protect ourselves with a wall.
Yeah.
That's all I have is just
hard to argue with that. Patsy, Mike, you got to close. You want to do?
Did James want to say something?
Go ahead, James.
Yeah, I'd like to weigh in and encourage everybody who's still struggling with substance use disorder to pick up the telephone, seek some help, look to the Blue Ridge Resource Center, get your recovery coach. We know that the opioid disorder is a disease of isolation. Pick up the phone today, right now, and call 304-839-7924, or you can reach me at boydbw@msn.com. And be innovative. The Marines are not coming over the hill to rescue us. You are seeking resources. John said that, by the way, a couple of days ago. They're not coming. They're not going to show up. We're not even on the radar as the Marines. The Marines are already here, and the Marines are us as a community. In order for us to become recovery-ready communities, we have to band together, look together, be together, do things together. Pick up the phone and call someone. Let's create a Zoom room, virtual Zoom room meetings, 24 hours a day. And that's my take on that for today.
Excellent.
Thank you, James.
Yeah, I would just, Mike, were you going to say something?
No, go ahead, Patsy. I'll close it out.
Okay, I was just going to say that, I think it's important for everyone to remember that you've heard this a million times, we are all in this together. We're all so vulnerable in one way or another, either personally or from someone affected by it through friendships, familial relationships, just co-workers. We're all in this together, and we have to be considerate of each other. do what you can to protect the other person. And I think if we do that and we can continue to realize that we care about each other, you know, we live in an area where a lot of us know each other. And I don't think anyone would wish bad luck or bad harm to come to anyone. But you know, we're all in this together, and I hope that people will realize that and stay as safe as they can and keep others safe in the process.
All right, that sounds like that's like a prayer for this week.
I wanted to, John. If you
Go ahead. Oh, thank you, Bernie.
just give me a second. I just wanted to thank my colleague, Councilwoman Noland, doing a fantastic job. Okay. Here's the thing: we all have to remember. All right, we are the ones we're looking for, right there. And that's it. Thank you, everyone, for
Okay.
the end of the road with your original Dusty Footed philosopher and host, Mr. John Case. Our guests today, Patsy Noland, Councilwoman Patsy, did a great job. Thank you so much. Lawrence Bish, of course, the other original Dusty Footed philosopher, and that cool dude, James Boyd, coming from New Jersey. We thank you, James, for all your work and everything you do. I'm the loud voice guy on the end of the road, Mike Cuccarini. Thank you.
All right, man. Take care, guys.
Thanks, everyone. Thank you.
Talk to you later. Thank you.
Be safe.